Good morning, Ma'am Helen. My name is Josephine Tulay, and for today, I will be performing the procedure in assessing the nails. So the nails located on the distal phalanges of the fingers and toes are hard, transparent plate, keratinized epidermal cells that grow on the cuticle. So the physical assessment of the nails is important because this may provide data that may reveal any local or systemic conditions or alterations in the self-care activities of the client. So let's proceed with the assessment and planning. So first is to check for the doctor's order. So it is vital for achieving and maintaining good health. Also, it is useless if we will not follow the treatment plan and the diagnosis of the doctor. So we should always take note of that. And also, checking for the doctor's order will determine the need for assessing the nails. Next is for the implementation. So first is to identify your client, because this will serve as a verification that we are in the correct client, and also this will ease anxiety and will gain cooperation. So first, we will introduce myself to the client, and then I will ask his or her name and birthday. Good morning, ma'am. My name is Josephine Dula, and I am your nurse for today. May I know your name, ma'am? Okay. So, may I know your birthday, ma'am? Okay. Thank you po. So next is to explain the procedure to the client, why is it necessary, and how he or she can cooperate with the procedure. So an explanation will reduce apprehension and will gain cooperation from the client. So ma'am, for today, I will be assessing your nails. So is that okay with you, ma'am? Okay, so are you comfortable with your position right now, ma'am? Okay, that's good to hear, ma'am. Next is to wash our hands and also observe for appropriate infection control procedures. So it is very important to wash our hands because this will prevent the spread of microorganisms. So I have already washed my hands prior to this. So next is to provide client privacy. So we should always take note or give consideration for the comfort of our client. So we can close the curtains or doors to give warmth and privacy to our client. So next, we will determine the client's history of the following. Ma'am, do you have any diabetes mellitus? Okay. So do you have any circulatory diseases, ma'am? Okay. So do you have any previous injury, ma'am? Okay. So any severe illnesses, ma'am? Do you have any? Okay. So this is important to assess if the previous diseases or health condition of the client can affect to the certain or the current situation of the nails. Also, interviewing will provide us data that may reveal any local or systemic conditions with regards to the nails of our client. Now, we will inspect for the fingernail's plate shape to determine its curvature and angle. So this is to assess for any possible previous trauma. So for the normal findings, there should be 160 degrees angle between the nail base and the skin. So for the abnormal findings, you should also take note of early clubbing, which can occur with hypoxia, and also the spoon nails, which can be an indication or may be present with iron deficiency anemia. So now we will inspect the nails of our client. Okay. Okay, so next is we will inspect for the fingernail and toenail texture. This is to assess if the texture of the nails are healthy. So for the normal findings, the nails should be hard and immobile, and also we should take note for the abnormal findings because thickened texture may be caused by decreased circulation and also can be seen in onychomycosis. Also, paronychia or inflammation may indicate a local condition. So now, we will inspect the fingernails and toenails of our client for the texture. Okay, so we should take note of our observations. Next is we will inspect for the fingernail and toenail color. This is to determine if the nails or the color of the nails may indicate any symptoms of diseases in the body. So for the normal findings, the pink tone should be seen. Longitudinal ridging is normal. So pale or cyanotic nails may indicate hypoxia or anemia. So hemorrhage in the nails may indicate trauma, and yellow discoloration in the nails may indicate or may be seen in psoriasis. Also, nails pitting. So now, we will inspect for the color of the nails of our client. Okay, next is we will inspect for the tissues surrounding the nails. So this is to determine if it is in good or normal condition without affecting the growth of the nails. So now we will inspect for the tissues surrounding the nails. Okay, so we're done with that. Next is we will perform a blanch test for capillary refill. So this is to test the nail beds and to know the blood flow to the tissue. So for the normal findings, so the pink tone should return immediately to the nail beds when pressure is released. So for the abnormal findings, so if there is a slow capillary refill, this is associated with cardiovascular or respiratory diseases that may cause hypoxia. So to do this, we will press the nail tip briefly and watch for color change, especially when the pressure is released. Okay, so we will take note of that in our documentation. So lastly, for the documentation and evaluation, we will document the findings in the client's record because this is for legal purposes and for the patient's record. So that is all for assessing the nails. Thank you.